Hello, and thank you for tuning into the Texas Women's Foundation podcast, Strong Women, Better Texas, where we'll discuss topics that impact the lives of women, girls, and families across our state, and how we can individually and collectively create solutions to build stronger women and create a better Texas. I'm Karen Hughes White, President and CEO of Texas Women's Foundation. Our mission is to drive meaningful social and economic change for women, girls, and families statewide by leveraging our resources to invest in research, advocacy, grant making, and leadership training to support our vision of an equitable society where women and girls can fully participate. We're kicking off this podcast with our first series, The State of Women in Texas. In this series, we'll be sounding the alarm on some of the most concerning issues and statistics about the realities facing women, girls, and families in Texas. These findings explain why Texas ranks 47th out of 50 states for women's overall economic success and well-being. How is this possible in a state with one of the largest and most robust economies in the nation? Well, stay tuned. You're about to find out. Joining me today is Kristen Lenau, Women's Health Policy Director for Healthy Futures of Texas. Kristen is a policy leader with 15 years of experience working with and on behalf of populations impacted by poverty and violence. She holds a master's degree in public health and has been doing criminal justice and public health policy work in Texas since 2016. As policy director for the Texas Women's Healthcare Coalition, Kristen supports the health needs of low-income women at the Texas legislature and in state policy and regulatory work. In this episode, we are going to discuss the issues of affordable and accessible healthcare in our state and how this is affecting women and families and even the state's workforce. We're going to talk about advocacy initiatives taking place and how we can work to create change. Kristen, hello, and thanks for being with us today.
Thank you so much for having me. I'm really excited to be here. And our mission at the Texas Women's Healthcare Coalition is to ensure that we can advocate to support the state women's health programs so that women across Texas have access to preventative and preconception care that will allow them to plan for healthy pregnancies. So we're really excited to join you today.
Well, thank you, Kristen. You're doing the good work, right? We thank you for the great efforts you're making to support women and families across our state who desperately, as we all know, need quality and affordable health care. Texas Women's Foundation first released our Economic Issues for Women in Texas research in 2014. And access to health care has always been an economic barrier for women across our state. So here we are, more than 10 years later, still having the same conversation, with Texas being one of the lowest ranking states for women's health care, where 1 in 4 full-time, year-round female workers lack the protection of health insurance. So can you educate us on some of the complexities of providing health care to women in Texas, particularly over the past 10 years?
Yes, for sure. I will say that it kind of, from my perspective, tends to fall under an umbrella of barriers that are happening between the patient and your providers. So patients are constantly facing hurdles, whether that is their health plan no longer being accepted at a doctor, or the fact that there might not be any providers in their community that they could even go to. A lack of primary care physicians in Texas has been a big challenge. And then on the provider side, we're seeing issues like reimbursement rates being too low. We're seeing issues like providers not wanting to set up a clinic in West Texas or far North Texas because they simply cannot, find the patient population to care for to justify that kind of expense. And so that all, contributes to the challenge of ensuring that women can get health care. And then when you add in the complexity of the health plans and the insurance coverage that we have in Texas, it becomes almost an insurmountable challenge in order to suss out where these problems are occurring and why they're occurring. And so one of the things that we hear the most about are related to premiums, and, not just premiums that the patient has to pay, premiums that an employer has to pay. And those are going up and going up and going up, and it makes less and less sense for an employer to provide health insurance for an employee. And so that's going to impact their ability to join the workforce, and it's going to impact their ability to retain talent, and it's going to cause patients and women, all of us who really need healthcare, to look elsewhere for economic opportunity. And so we are really hoping that instead of kind of shooting for the stars in terms of like super specialty physicians, in one really well-populated area, we can really kind of raise the floor for everyone, because the landscape of challenges, just both geographical challenges, policy challenges, and cost-related issues, I worry pretty regularly about the entire thing collapsing, just because we're not seeing providers move to those areas. Medicaid reimbursement rates are not consistently going up. Healthcare costs are getting more expensive. So there's just so many different areas that we can talk about. I could go on for an hour. But I think if we can focus on that relationship between a healthcare provider and a patient, and what are the obstacles, the hurdles that exist between those two being able to work together. If I need to go to a doctor for something and the doctor orders an MRI, for instance, I then have to negotiate with my health plan to cover the MRI. The doctor also has to negotiate with the health plan to cover the MRI. The health plan probably has, physicians on staff that will look at my chart and decide whether or not my doctor is correct if I need the MRI. And then they will also add in this thing called step therapy. So did I do 6 weeks of physical therapy before they ordered me the MRI? And did that take care of the problem? Because if it did, then we're not getting an MRI. So it's become so onerous to just provide care to Texas women that we really need to focus on how do we reinstate this relationship between healthcare providers and patients in a way that is sustainable.
Well, it's not lost on me, right, that non-medical professionals are often making some of these decisions, right, along the way, right, which is insane. And it's also not lost on me that the geography, that just the sheer scale and scope of Texas as a state is a unique challenge for us. But, in addition to those things, why do you think Texas is more challenged in the area of providing health care to women?
Well, our system is very much a patchwork. We don't have, consistent, reliable payer sources for, Texas women. We have a patchwork of employee-sponsored health plans. We have a patchwork of managed care organizations that are administering our public insurance programs. We have a huge gap between people that can go onto the marketplace and buy something and folks who, are making too much money to qualify for Medicaid, or they have children that have high needs, but maybe there's no doctor in their area. So it's all kind of interwoven. But I see one of the biggest challenges being that we just have so many plans, so many regulations, And physicians and, nurses are having to jump through hoops just to be able to provide care. And patients on the other end are also overwhelmed by these systems. They get denials, they get requirements to do different treatment. And, more and more from, our providers, we're hearing that, specialists don't want to take their patients anymore. So the physician workforce, the nursing workforce is slowly starting to back away from wanting to take a lot of women that are on health plans that they used to take. And so it's just, it's a systemic problem.
Well, thank you for that, right? Thanks for sharing your insight and for breaking it down for us in plain English, right? So often I think it's really hard to understand the complexities, right? There's so many acronyms, you can quickly get lost in alphabet soup. And so I appreciate you breaking this down for us, right? Again, Texas being so vast, so diverse, unique challenges in providing access to healthcare, particularly for women in both urban and rural areas across the state. As you think about it, what might be one innovative policy shift at the statewide level that could positively impact women and families living in both urban and rural areas of the community?
Yeah, so I would say that if I were looking at the menu of options for this session, I think the most impactful and widespread benefit for Texas women who are struggling to afford care is to revamp our enrollment and our eligibility systems. And so we call them tiers, and it's essentially like a package of software and workforce, personnel that go through all of the applications that we have. So Medicaid applications, Healthy Texas Women applications, SNAP applications. They also, administer a lot of the Medicaid enrollment pieces. And so there's a combination of challenges that exist within those software systems and those folks working on those software systems that are creating an enormous backlog of patients that are qualified for, say, like pregnant women's Medicaid or Healthy Texas Women, but they cannot get onto it. The application is 13 pages long. It asks you whether or not, your father's tax information, and you have to put that on the application in order for it to even be considered complete. So anyone you live with, you'll need all of their details, all of their assets, everything under the sun goes into this Medicaid application. And so the state has asked the legislature for a significant chunk of money, close to $500 million, to overhaul the entire thing and to add additional FTEs to support processing applications. So we're really supportive of that budgetary ask by HHSC. We think, with a system that actually worked, people would get access to care when they needed it versus, 6 months later, when it is no longer an emergency. And so that's really the big one that I would say has the potential to have widespread positive impacts.
Well, and I love it, right? So what's disconcerting, right, is in addition to sort of the system being broken, there are process improvements that are needed. I know you just talked about a $500 million number. That's big money, right? But we also know the legislature is working with a surplus, right? How to allocate that surplus. And it feels to me like this is an area that would do the greatest good, right? So thank you for championing that, and know that we will be right by your side as you do so as part of the Texas Women's Healthcare Coalition. So let's talk more about the well-being of women and how it impacts our overall economy here in Texas. So, a recent report just shared at the Davos Economic Conference in Switzerland a few days ago says that reducing the women's health gap worldwide could create around $400 billion in annual global GDP by 2040. So those are big numbers too, right? In Texas, we know from our research that women are drivers of the economy, big drivers, right? Driving growth, driving innovation. We also know that COVID clearly demonstrated without fail that women are essential workers here in Texas. Now, our most recent Economic Issues for Women in Texas report also showed that 24% of working age women, say 19 to 64, are most likely to be uninsured as compared to their male counterparts. So, how is the Texas legislature currently addressing the intersection of women's health and the state's economy and workforce?
So I think they have a number of options in front of them. I would say that related to this intersection of healthcare and workforce is childcare for women, right? You know, we're the primary caregivers, whether we're taking care of our parents or we're taking care of our children. For a lot of women that want to participate in the workforce, it does not make sense financially to put your child in daycare so that you can work. And so when I had my daughter and she was an infant, she was in care, her daycare expenses were more expensive than our mortgage on a monthly basis. And that
Unbelievable, right?
Yeah. Yes. And so I think a lot of folks in, our, 19 to say 45 range are thinking that they can't afford to have children, or if they want to have children, then that would mean that they don't get to work unless they're having a job that is, extraordinary. But it feels like a real privilege in Texas if you have access to safe, high quality childcare so you can work. And the childcare expensive and the health insurance premiums have just become so outrageous, and wages have not kept up. So for a lot of moms, you're looking at, do I work?
Right.
Do I have children? If I want to get health insurance and my employer doesn't offer it, then I really can't get it unless I look for a plan on the exchange and hope that there are providers in my community that take that plan. But you're weighing these really major life choices against each other, because for most of Texas women, you don't get all three. You don't get to have a job, have health care, and childcare. You have to pick one or two of those things, and that's the situation that we are in. And so, our organization isn't leading on childcare initiatives, but there is a coalition called Employers for Childcare, E4C. Yeah, and they put out an amazing set of recommendations for the legislature to look at when it comes to trying to fill these massive holes in our economy. And so I would encourage folks to look into them and to support those policies, because I think if women can work and go to work knowing that their kids are safe and they're healthy, then we can solve a lot of these problems.
Yeah, I think it's the only way to bring your full and whole self to your work, right? If you're divided between doing a great job and worrying about the safety, right, and well-being of your child, no one is able to bring their best self. It's funny that you mentioned Employers for Childcare. We'll have their chief policy officer as a guest on one of our podcasts in this series. And I agree with you. I think that the choices that women have are not good choices. They're not, right? And it's terribly, I want to say, unfair, right? I think the more accurate term there, it's inequitable because men do face those choices, right? And the issues are so interrelated. So Texas Women's Foundation, and I know you know this, right, takes a dual approach to supporting healthcare. We recognize the importance of investing in community-driven healthcare services that directly address the needs of women, while also advancing policy-driven initiatives aimed at creating the kind of systemic change that you and I are talking about that. So in that same vein, how do you envision private and public sectors, advocacy organizations, and community groups coming together, collaborating to tackle these challenges, to create opportunities for women and families to thrive in Texas?
So there are a couple of examples of this kind of collaboration that comes to mind for me that have been really central to our work. The first one is related to the passage of postpartum Medicaid for pregnant and delivering women here. And that bill, HB 12, for 12 months, was passed out of the legislature last session, and it was implemented about 10 months ago. And the coalition of groups that were supporting this legislation and advocating to see it through was incredible. It was an incredibly diverse group of associations and policy folks, advocates, patients. We saw both, folks from the faith community, as well as the health plans, as well as the physicians. So groups that traditionally tend to be on opposite sides of a policy change were all in favor of this policy passing. And because of that, it did. And so there was just so much unity around addressing this problem in this way that we were able to move the needle on that. And so that was an incredible moment of collaboration.
I think that's a great win, right? And it underscores the fact that there are some undeniable truths, right? That regardless of how we show it up at the ballot box, right? Regardless of which aisle we may side of the aisle, right? We may sit on, that we can come together and solve for some of these issues. So thank you for sharing that, and thanks for the work that the Texas Women's Healthcare Coalition did to spearhead and drive HB 12.
Yes, I mean it was amazing, and we can't take the credit for all of it. It was, a priority of one of our members, and but it's been revelatory, I think, in a lot of ways. One of the implementation efforts around this bill is just to even get the word out that it happened, because there are a lot of medical providers that aren't aware that it passed. And so the work continues there, but it's just such a great outcome after a long time of trying.
Well, I think, as we know, right, healthy women, healthy families, a healthy Texas, right? We know that, right? And we should mention that the Texas Women's Healthcare Coalition represents more than 80 members, including Texas Women's Foundation, that include direct service providers, nonprofit organizations like ours. So tell us more about what this diverse and powerful group has sort of lined up for this session, the 89th session, right, as legislative priorities.
Yes. So our main priorities this session are going to focus on funding in two areas. The first area being our mandate, our reason for existence is to support the three safety net women's health programs in Texas. Those are called Healthy Texas Women, the Family Planning Program, and the Breast and Cervical Cancer Screening Program. And those programs collectively serve and enroll close to 500,000 Texans every year. And so ensuring that those programs are fully funded, that there is room for costs to go up, for caseload growth to happen, is our top priority. And we have had a lot of really fantastic support from legislative leadership on these programs and on this issue. And so we're working really closely with the folks in the Finance Committee to ensure that all of the budget asks that need to be there are there by the time we get out of here at the end of May. The other major priority that is a funding initiative that our members push forward this session is to enhance and kind of expand the Texas AIM program. AIM stands for Alliance for Innovation in Maternal Health. And what it is essentially like a best practices program that's administered through the State Health Services Department. And it creates these teams within hospitals that will address some, consequences of severe maternal morbidity and try to prevent them from happening. So right now we have teams all over the state and all of our, trauma hospitals where they do labor and delivery that have been trained on postpartum hemorrhage. They are going to be implementing new bundles in the coming years, one of them being for sepsis. And so the more resources that we can give to this program, the more hospitals and birthing facilities, they can train on how to prevent, common maternal deaths. And so we're going to ask for additional funding for that program. And then finally, we have, as you mentioned, around 80 members in our organization. And so we like to save space and time to be able to support some of the policy changes that they're also making or, trying to get through. So there are a couple related to access to birth control. That's one of our primary areas of concern. And we did pass legislation on it last session. And so we have a few members that are going to be working on policy to increase access to birth control. Additionally, one of our members is working on a bill that would add doulas into full Medicaid benefits. And we're really supportive of that as well because doulas have been shown to be really beneficial for mom and baby, as well as a cost saver in many ways for health plans. And then finally, we're going to be focused on supporting the implementation and increasing funding for the mobile health units. These were something that we put together as a funding request last session, and the legislature funded it. But it essentially offers up grants to small or sometimes larger healthcare providers that are willing to do mobile preventative healthcare in deserts, in the healthcare deserts that we have in Texas. And so last session, we were able to get 7 of those funded. And this session, the legislature is looking to increase that funding to put mobile units in West Texas and in North Texas, where we have some significant coverage gaps. So those are the big ones we're looking at.
It's amazing. It's a full slate for sure. And knowing, right, that incremental progress is always good. What would you consider a big win for healthcare, women's healthcare this session?
I would really like to see the tiers overhaul get through. I'd like to see this doula bill, as well as some other bills to, increase access to support services and community-based health workers. I think that those are significant and just really positive developments that we could see happen here. And then, of course, I'm always going to go back to funding. So a significant win for my team is making sure that our women's health programs remain funded. One of them is a Medicaid waiver program, and so it is dependent on federal funding. Unless that, if that were to go away, we would have to ask the legislature to help prevent provider closures. So we want to see the programs fully funded. We'd love to see some maternal health changes happen, and the system of enrollment overhaul is a huge one.
Well, certainly we are living in interesting times. right? Particularly in these first 100 days, right, of a new administration. So, lots for us to consider as part of the coalition, both at the state level and the federal level. Lots to watch and learn about. As we wrap up today, what would you tell our listeners they can do within their power to influence and to help support or advocate for women's health care?
Well, I think one of the biggest things you can do as a constituent is to set up meetings and take, do some phone calls with your elected officials. So we see a lot of people coming to the Capitol during the legislative session, and that's good. Like, we want that. However, they're working all the time. And so it can be much easier to access your elected officials during an interim time period or during the summer. And so it's not something, it feels like we have a part-time legislature because we're trying to do everything in 5 months. But really, the conversations and the advocacy are ongoing. They don't start and stop when session starts and stops. That's just kind of the culmination of 2 years of work by those folks, by advocates, by other policy groups. But that work requires engagement and building relationships and getting to know who your elected member is. And so if you don't know who your elected representative is, I would find out. You can go to Texas's website. It says who represents me, and they'll tell you who they all are. And start getting to know them. Let them get to know you. Talk about what's important to you. Even if there's not a bill right now, it doesn't mean that building that relationship and educating your member on issues of importance, can pay dividends down the road.
Kristen, thank you. I think that's great advice. I think at this moment with so much change, so many people feel confused, maybe frightened, and maybe a little helpless, right? So those concrete actions are so helpful, I think, to folks who are wondering what they can do, right, to engage. So thank you so much for being with us today, for sharing your expertise, your insight. Looking forward to working with you through this session and to doing the good work with the Texas Women's Healthcare Coalition. Thanks so much.
Thank you. It's been a pleasure.
Well, we hope you enjoyed this episode. We invite you to learn more about Texas Women's Foundation's research. You can go to our website, txwf.org/research. When you get there, you'll also find ways that you can engage. You can share messages on social media and other ways to support our mission. Special thanks to Kristen Lenau for joining us today, providing her valuable expertise and insights around healthcare for women, and those great suggestions on how we can advocate for and support this critical issue for women and families in the great state of Texas. We are grateful for the support from the Dodie Frost Crockett Endowment, which is funding this podcast. Dodie has been a longtime friend and supporter of Texas Women's Foundation. Her contributions to our mission support the work that we're doing today to share these insights with a broader audience, to build a movement of champions for change. I'd also like to thank our partners at ISP Creative for helping us put this together. They're the behind-the-scenes magic. Now, make sure you tune in to hear more about the state of women in Texas in our upcoming episodes that will be released weekly. You can find them on our website, txwf.org, and on social media at Texas Women's FDN, along with ways to support our mission. Thank you for joining us as we work together to build strong women, better Texas.